a 7-year-old, I experienced two major events that changed my life forever. Walking into HEB, I picked a cherry sample and gladly ate it. Soon, I experienced a horrible itchiness, tightness, and swelling that resulted in a swollen lip and throat. Earlier in the year, I also noticed every time my second grade class ate apples for lunch or used them in a science lab, I had a tightening in my chest, itchiness in my mouth, and a spreading rash. After an appointment with my allergy and asthma specialist, I was diagnosed with OAS, or oral allergy syndrome. Oral allergy syndrome is a common and confused allergy that many people have. Dr. Robert Eaches, an attending physician at Cedars-Sinai Medical Center, said that, quote, oral allergy syndrome is very common, end quote, and that he has about 500 patients with it. To understand oral allergy syndrome in its entirety, we first must establish what it is and why it happens, the signs and symptoms that come along with it, and how to live with it. So first, what is oral allergy syndrome? Oral allergy syndrome is a food allergy classified by allergic reactions in the mouth and throat in response to eating fruits, vegetables, and nuts. Oral allergy syndrome is also a type 1 hypersensitivity or a true allergy, where the immune system produces antibodies against pollen, which cross-reacts with similar proteins. Basically, the body cannot differentiate between a pollen protein and a fruit or vegetable protein, so it sends antibodies to attack it anyways, which causes the reaction. So what causes oral allergy syndrome? In adults, up to 60% of food allergic reactions are due to cross-reactions between food and inhalative allergens. The causes of oral allergy syndrome are based on the pollen the individual is allergic to. Grass pollen and the cross-reactive allergens are the least understood. Just to name a few examples, alder pollen correlates to apples, cherries, and strawberries, while birch pollen creates an allergen for almonds, avocados, and bananas. Grass pollen allergens can make a person allergic to melons and tomatoes, while mugwort creates carrots and pepper allergens, while ragweed creates cucumber, watermelon, and zucchini. Interesting enough, I was not born with OAS, and very to no people are. It is a syndrome that is developed over time and normally begins during late childhood into early teenage years. Next, you may be wondering, how do you know if you have OAS? Sufferers may have any number of allergic reactions that occur very rapidly within minutes of eating a trigger food. Personally, I knew I had OAS after severe experience with both apples and cherries, and I began to avoid eating most fruits or vegetables to limit my experience with these reactions. This is obviously not a normal thing to do as a child, so I went to go get tested to see why this was happening, especially because of my severe reactions to these foods. OAS presents itself mostly in fruits, vegetables, and nuts. Honey and some flowers may also be included. The allergens to any other food is most likely not correlated to OAS. So what are the symptoms you experience? Symptoms may vary, but tend to be concentrated in the mouth region. Symptoms also often worsen during fall or spring pollen season. Personally, the reaction I have is completely dependent on the food I eat. Tomatoes, onions, lettuce, and jalapenos are some foods that I still sometimes choose to eat on burgers and salads because of the reaction is not as severe or life-threatening, only slightly uncomfortable. In contrast, avocados, cantaloupe, broccoli, apples, and cherries present serious reactions that may require medical attention, so I avoid eating them at all costs. Less severe and common reactions include itching and burning sensation in the lips and mouth and ear canal, and swelling of the lips, tongue, uvula, and tightness in the throat may also be observed. More severe and serious reactions and symptoms of OAS include vomiting, diarrhea, severe indigestion, or cramps. OAS can also present itself as wheezing, hives, low blood pressure, and anaphylaxis. How do doctors diagnose OAS? Allergy specialists diagnose OAS by using a variety of tests, including skin prick tests, blood tests, patch tests, or oral challenges, which is the most ideal test. The tests are accompanied with a period of observation and possibly testing other factors such as exercise. In my personal experience, I had a skin prick test done in which they injected or pricked 44 different samples of fruit, vegetables, and pollen into my back and let it sit to see which sample swelled, welted up into bumps, or created a rash. What is a person living with OAS treatment options? Symptoms severity wax or wane depending on the pollen level, so a person must always avoid eating the triggering food, but they may peel or cook the food to consume them. Cooking the food or eating processed-like versions, for example, canned peaches or pineapples, which are my favorite, can be options because processing the food and cooking it alters or destroys the protein to the point where the body does not recognize it, and therefore it does not send antibodies to attack it. The use of antihistamines like benadryl may also be used to block the immune pathway. Patients with severe OAS may carry an epinephrine autoinjector, take oral steroids, or the more serious and curative option, allergy immunotherapy. Allergy immunotherapy can drastically improve or cure OAS in some patients with daily or weekly injections or of extracts containing the pollen or allergen. Allergy immunotherapy may not be an ideal treatment option, however, because of how often it takes away from work or school. To conclude, now by understanding what OAS is, the signs and symptoms and treatment options, we can understand how oral allergy syndrome affects people and why it occurs. Oral allergy syndrome is a complex and confusing allergy. And now you all know that I have oral allergy syndrome because of my underlying pollen allergy, the symptoms I have during an allergic reaction, and how I live with and treat this allergy.